So what we thought originally when we found out Botox was seeming to help patients with migraine was that it must be relaxing the muscles, and that's why it's working, because it relaxes muscles. That's why they wanted to give it to your son, to relax the spasticity in the muscles. What we found is that Botox is actually doesn't just get into the motor nerves that cause prevention of the chemicals to be secreted to the muscles. It also gets into the sensory nerves, where you inject it, and prevents the chemicals involved in migraine from being secreted. And that's how we think it's working. It's actually not working through, and we know now that it's not working through the muscle relaxation pathway, because they did a whole series of experiments was designed to look at that, and it doesn't work. It doesn't work when you're looking at that. When we inject Botox, if you don't get it on the street, there is a what's it called, a black market? There is a black market for Botox because people want it cheaper for their wrinkles. Exactly. So I don't know if you heard about a few years back, a few people were hospitalized in Florida with botulism.
They got oil in their face instead of, what was that?
You know what they got? The guy who injected them, he was not a physician. He wasn't a physician, and he ordered the Botox because the company that makes it won't give it to you. They won't sell it to you if you're not a physician. So he ordered it from one of those chemical companies that was doing, that used to give us scientists doing experiments. Well, they don't do the same kind of quality control because it's used in petri dishes. They're drug. So what happened was, when he gave the dose of Botox, it was incorrect. It was like incorrectly labeled, and he gave them a lethal dose that was incorrect. With Botox, when we use the real stuff, the good stuff, the dose that we give, if I took that entire, let's say I'm using 100 units of Botox, but I used to do your whole head. If I gave that whole syringe to you into one of your veins, you'd be fine. It doesn't, it's like 1/100th of a dose that would get you sick if I injected it all at once into your arteries or veins.
How many times do you need to go?
Or 1/1000th.
For a shot?
So you need them every 3 months. It's
and
not
one shot? Or
no, it's a series of injections every 3 months, potentially ongoing. Although I have potentially, theoretically, but I have many patients, I do tend to see a buildup, so people start to go longer and longer in between their injections and get more and more efficacy out of it over time. And probably as your migraines are improving, you can stop.
You look better.
You look better and you can stop. There's another interesting thing that I should actually segue to right here. There's also a new surgery that you may have heard of. This forehead lift that's shown some good efficacy actually, and you're laughing. It actually, if you look at the studies,
It's just driving me.
It's actually fairly efficacious. And what they do is they actually screen their patients with Botox, and if the Botox therapy works, then they're a good candidate for that surgery. It's not approved or anything like that. You just have to pay for your facelift now. But, okay, next. So what you can do for yourself, start a headache calendar, identify your triggers, your patterns, and your medication overuse that you're not aware of yet.
I'm aware.
You may be aware. You already see a headache doctor. I have a lot of patients who come to me saying, I have maybe, 1 or 2 a week, or, 4 or 5 a month, and then they come back and they're like, I have no idea how.
That's what happened to me before I kept my calendar. I thought I had like 4 or 5 a month. I was like, all right. Once I kept it, in like a 3-month period, it was like 17 I had in 1 month. I couldn't believe it.
Yeah, and when you start using all that Advil and Excedrin and stuff like that, you really run the potential of making things worse, and then you get medication overuse headaches. Eat a healthy, well-balanced diet. I'll stay away from the sugar issues that were already covered, and pay attention to your food triggers. Don't skip meals. One other note about food triggers is that they're very, very difficult to identify for most people. And in fact, most of the triggers, I didn't even list triggers, but most of them are difficult to identify, or they're often difficult to identify because a lot of people need more than one. So they could go, well, I had pizza on Friday and I didn't have any problems with it, and I had pizza on Sunday, and then yesterday I had pizza and I could swear it triggered a migraine. Well, it's probably because yesterday you also didn't sleep, And you also, I don't know, a big rainstorm, drop in barometric pressure, and increasing temperature can also, both of those things can trigger migraine. So, you know, big storm is coming and then you eat the pizza.
You're in trouble.
And you're in trouble. And you might not have identified either one of those as a trigger on their own, but when they're in combination, your brain reaches a threshold and bang. Some people have more frequent migraines, probably because their threshold is lower. They don't need so many triggers to all come together at once to trigger a migraine. Some people who only have a couple times a year probably have a very high threshold. They have that brain chemistry in there, but they're really they're resistant, they're well blocked. A little thing isn't going to trigger off a migraine, trigger off that brain chemistry. And so, like I said, a lot of times you need, and the same thing with treatment. You need a lot of different things together sometimes. So it's not about taking one medication and it's a magic pill, but it's about using all these different modalities together to come to a place where your body is kind of working, you know, more in harmony, where you're well rested, you're coping with your stress better, and you have a good migraine preventative. You're on Topamax or you're on, I prescribe a lot of stuff, but you obviously didn't have a good experience with it. That's okay.
Yeah, also.
Yeah.
With Topamax.
I became so stupid and no memory. And I got off of it and it still affected me. Like my memory has not come
No,
back.
I didn't have any side effects, but no help.
But no help. And yeah, some of the natural remedies that are also, have you tried Petadolex?
What's that?
Butterbur? I
Yeah,
think that's the
Petadolex
best one.
now. But now I'm doing magnesium.
Right, you said, and the riboflavin.
And that's,
But if you're doing well, good.
What did you mention?
Petadolex or Butterbur? Riboflavin, magnesium.
riboflavin is B2, what I was telling you.
I know. Magnesium I know. The first one that you mentioned.
Petadolex.
Petadolex, what it is?
Butterbur extract. And I think of the natural supplements that have been studied fairly decently, it's the best one. Like I have really good success with it in my patients. But I wanted to comment on this, the losing weight, because it's not just and lose weight because it's healthy. There are good studies looking at weight loss, and it can actually decrease the risk of developing chronic migraines over time. So if you're a migrainer, losing weight will help, or keeping your weight down, keeping your BMI, your body mass index, in that normal range, the healthy range, will help prevent your migraines from getting worse over time.
That could gain weight, make your migraines go away.
Statistically, no, we don't have any studies that show that.
We're going to have a workshop to work out. Lose weight, no migraine.
And I think you just go quick and we'll, and I think